Menopause or perimenopause can feel an embarrassing time in a woman's life. A lot of people don't even want to talk about it or discuss, and sometimes don't even recognize what might be happening to them. Well, when the human lifespan was short, women almost resigned to the fact that their life was pretty much coming to an end with menopause. But now things have changed. Our lifespan is longer, and women almost have 1/3 of their lives after menopause. Why am I, as a psychiatrist, talking about menopause? Well, because menopause or perimenopause affects every aspect of our physical well-being and mental well-being. So it's appropriate that we talk about menopause when we talk about mental well-being. So let me introduce Beth Thomas. Beth, would you like to talk a little bit about yourself?
Thank you. Hello, and I'm delighted to be with you today. So my name's Dr. Beth Thomas. I'm a GP in Surrey. I've been a GP for many years now, but I've got a particular interest in women's health. And over the last few years, be that my age, my women's health interest has really honed in on menopause. And I'm now a menopause specialist, and I do I work for everything menopause as a private menopause specialist alongside my GP work.
Fantastic. So really grateful to Beth for being here, and we're going to discuss, what the common signs and symptoms. We're going to talk about why we feel the way we do, especially from a mental well-being perspective. We talk about, and Beth, you're also going to tell us top tips on how to manage
Absolutely.
it. So let's start with the common signs and symptoms, including physical and mental health, when people are perimenopausal, in the different stages before, then the menopause, and then postmenopausal. What should women expect and what should they look out for?
That's a really great question, and I think one of the first difficulties that some women have is that there's this belief that menopause is when your periods stop, and if you're still having periods, you can't be menopausal, and that's absolutely not true. That menopause is actually a retrospective diagnosis, so you can only say that someone went through the menopause a year after their periods stopped. Perimenopause is that period of time when your ovaries start reducing the amount of estrogen they produce, and that gives you all sorts of symptoms and signs. And that can go on for several years before your periods actually stop and you go through the menopause. So the average sort of period of perimenopause, menopause is about 7 years. So a lot of women come to me and say, but I'm still having regular periods, so I can't be menopausal. That's not true. You absolutely can be. And I think, don't worry if you're still having periods. If you're having the other symptoms, then, and you're in that sort of age bracket of 45 onwards, and even younger, in about 10% of women start the menopause symptoms below 45, then we need to be considering, is this hormonal? Is it that your estrogen is falling off? And the sort of symptoms women might experience. So estrogen is produced just by the ovaries, and we have estrogen receptors everywhere in our body. So every part of the body can be affected by that fall in estrogen. And unfortunately, estrogen doesn't fall off in a nice smooth graph. It falls off all over the place. So you get these fluctuating bursts of estrogen. It's low, then it's high. And so what women often see that are still having periods is that their symptoms are worse just before their period, because that's when your estrogen's naturally at the lowest. And the sort of classical symptoms people talk about are the hot flushes and night sweats, and they're absolutely a problem. Interestingly, they actually only affect 3/4 of women. So 1/4 of women will never get those symptoms. And so again, you have these women that are still having periods and not having flushes, and they say, well, I can't be menopausal. But actually, if you really dig into it and you find out that they're experiencing other symptoms, mood symptoms are a huge symptom, particularly in younger women, so particularly below the age of 50. And what I see is a lot of anxiety, social anxiety, so fear around driving at night, and these are women that maybe have never experienced anxiety before, and low mood, and just that sort of lack of joy, lack of enthusiasm for life. They've got no reason, their life is okay on paper, but they just can't get that enthusiasm. So that's a big problem. We see a lot of what I call cognitive symptoms. So people talk about the brain fog.
Yes.
But it's that people come to me saying, I think I've got dementia. I mean, I can't, it's the word finding difficulties, their memory, they walk into a room. Why have I come into this room? And that is really common. So those are the sort of mood things. And then physically, obviously the flushes and the sweat, we see things like dry skin, dry hair thinning, palpitations, that's a huge problem. Urinary symptoms, so dryness down below, recurrent urinary symptoms, joint aches, that's a big problem. So they really can affect every part of the body. And so I would say that don't just worry about if you're still having your periods or if you're not getting flushes, look at those other symptoms.
That's really helpful to know. And yes, I mean, I see a number of people with complaints about brain fog. You know, am I having depression, or am I having, is something happening to my brain? A lot of women come to see me for memory problems, and you know, looking at that age, often it's a differential diagnosis. So Beth, and I also know that it does have a huge impact, not only for the women, you know, who are undergoing these symptoms, because a lot of loss of confidence. Because women say they're sitting in meetings, they are not getting what is going on in the meeting, and often they are in and out, phasing in and out. So it's a lot of loss of confidence in different aspects of life, and at home as well, the impact on spouses and children. And do you see a lot of that?
Oh, absolutely huge problem. And I think what happens is it's often at an age in a woman's life where they're juggling a lot of balls. So they're often got a busy career, they maybe have got teenage children, they've maybe got caring responsibilities for aged parents. We haven't got the facility in our life to drop balls, and what's happening is everything's becoming much more difficult to keep those balls in the air. And so what I see very much is that women will lose confidence with their ability to do the job, because they can't remember anymore, and they see these young people coming behind them, got better memories, and they're having to write everything down, and they're forgetting meetings, and they're turning up at the wrong time. So they're not going for promotions, and they're not putting themselves forward for bigger roles, and then it's got impacts at home on their relationships with their spouse. Women are often exhausted, your libido drops off anyway, so often, you know, the physical relationship with a spouse drops away, and that has its impact on the emotional relationship, and that's very common as well. So it's got a ripple effect on all aspects of women's life.
It does, and I think it's fair to say that not everybody will experience these symptoms, but there's a proportion of women who will experience these symptoms.
Absolutely.
So obviously this is a very biological phenomena, right, Beth? Because it's all hormones and the neurotransmitters that deal with depression, anxiety. Would you say something about that? Why does women suddenly start to feel these symptoms? Why are female hormones bothered with mood and anxiety?
Well, as I said before, so estrogen receptors are everywhere in the body, but particularly found in the brain, and the sort of drop off of estrogen seems to have a particular impact on the serotonin and the dopamine levels in the brain, which we know are so important in our mood, and that's probably why it's got such a profound effect on mood.
Yes, absolutely. So we've talked about, you know, signs and symptoms, we talked about the why. So it's really important to know that it feels like a doom and gloom picture, isn't it? But it doesn't need to be. And when I see individuals or women who are going through this phase, I often say that it can be used as a platform for change, right? Yes, you might be going through these symptoms, but understanding the why and what is happening is the first step. That's the self-awareness step. But it can be used as a platform for transformation. And think about, you know, you're in a phase of life where things can be different, things can be more exciting despite the symptoms. So what can women do to help themselves from a medical perspective and non-medically? How can women look after themselves during this time? What treatments are available, medical, non-medical, and what would be your recommendations?
How long have you got? No, I think that's what you're saying is so true about it's not all doom and gloom, and I think it can be a real opportunity for women to sort of enter their second phase of life in a really positive way. I think the first thing I would say is about recognising and educating yourself and knowing that that does sound like what I'm going through, and okay, I haven't got flushes, but maybe I am menopausal. So I think educate yourself, and there's some great resources that things like the Women's Health Concern website and Menopause Matters and the Balance app, and find out what's going on. In terms of what you can do, first of all, so we know that being generally healthy will definitely improve your menopausal symptoms. There is really good evidence that regular exercise, cardiovascular exercise, reduces hot flushes. There's also really good evidence. What we worry about at this age is the effect of the loss of estrogen on bones. That's something I'm very passionate about. And what we want to do is make sure women don't get osteoporosis in later life. So weight-bearing exercises, walking, Pilates, something with a bit of strength, that's really important. So exercise, healthy diet, losing weight. We know that women that are overweight are more likely to struggle with menopausal symptoms. Sadly, alcohol definitely makes things worse. So I'm not saying no alcohol at all, but I'm sure most women in my age bracket will recognise that if they have more than 1 or 2 glasses of wine, the next day anxiety levels are often worse than just that funk. So really trying to minimise your alcohol and your caffeine. You get a better night's sleep, and we all know things are better on a better night's sleep. So exercise, diet, reduce alcohol are the things that we can do immediately. Cognitive behavioural therapy, which I'm sure you've talked about before, has got a really good evidence base for improving menopausal symptoms, really good evidence base. So there are some women out there that can't have hormonal treatment, can't have HRT, women that have had breast cancer. And for them, CBT is so important, but for all of us, it's so important. And I often recommend to women, and you may have other resources, a book by Myra Hunter called Managing Hot Flushes with CBT, and it's just a 4-week workbook looking at some relaxation techniques around how to manage poor sleep and flushes. So I would do that. So those would be my sort of lifestyle things that we really talk to women about trying to do and having a healthy lifestyle. I'm sure you've talked about that before. In terms of then medication that we can use for it, and the thing that people often know about is hormone replacement therapy. And the basis of that is you're giving back women the estrogen that they're dropping off, and you're not giving them back the level that they had in their 20s. You're giving them back a little bit just to even out their symptoms and to make sure their estrogen is in a sort of steady state, so you're not getting those wild fluctuations of it. So that's really important. What we all know is that if women still have a womb and we just give them estrogen, they get thickening of the lining of the womb, which increases their risk of womb cancer. So we give a second hormone called progesterone to keep the lining of the womb nice and thin. And that's really what hormone replacement therapy is. It's those 2 hormones, estrogen and progesterone. And I can talk about this forever. We tend to give what's called body identical, which is the most similar to your naturally produced estrogen and progesterone. And what we like to do is give estrogen through the skin, so as a gel or a patch or a spray, and that doesn't have any blood clot risk associated with it. And then we would separate and give the progesterone as a tablet at night. And the one that's in the news a lot and that we use is something called micronized progesterone, which is very natural. It's made from yams, and it's the most similar to the body's progesterone. Some of the studies, the breast cancer risk studies that came out 20 years ago, they were done on much more old-fashioned HRT, much more synthetic, that we don't use so much now. And we know this body identical HRT is definitely the safest way to deliver it. Having said all that, if there are women that don't want to go on HRT or can't go on HRT, for example, they've got breast cancer, there are other medications that will help, and most of them you'll be very familiar with, because actually most antidepressants are also found to be really helpful for menopausal symptoms, particularly for flushes. We like to use venlafaxine, but all the SSRIs, so the sertralines and the citalopram, we know will help with those mood symptoms in particularly in the menopausal years. So I think if you can't have HRT, then don't be downhearted. There are other things available.
There definitely are, and that's where I end up seeing a lot of women who are perimenopausal, and it makes sense because, as you said earlier, the female hormones, they are acting on the chemicals in the brain that cause depression or anxiety or affected or they affect our mood, etc. Now, a lot of women get very upset about weight gain, Beth, and so key things, weight gains, hair and skin, obviously, these are all vanity things, but with age we become more conscious, and a lot of women's confidence drops because the skin, the connective tissue, the hair start falling, weight starts to go up. Any advice on what can one do for these things? Any medical or non-medical,
I mean, I think
Lifestyle changes.
lifestyle. So keeping well hydrated, we know that's important. Wearing a really good high factor sunscreen. We know that when your estrogen drops off, in that period is when your collagen decreases and your skin loses its elasticity, and unfortunately those wrinkles come. So the really good high factor SPF 30 all year round, and probably 50 in the summer is what I wear on my face all the time, and keeping well hydrated. In terms of what else you can do, so HRT is not going to cause you to lose weight. So a lot of women are hopeful it will. It won't cause weight loss. It shouldn't cause weight gain. That's the other thing I'd say. Some women find they get a little bit of water retention when they first go on it, but it's minimal. What we hope is that if you sleep better and you're feeling better about yourself, that then you can have the energy to stick to that sensible eating plan and exercise more. And I cannot underestimate the importance of getting out, even if it's just for a walk every day, for your mental health, for your physical health. At the time of the menopause, your metabolic rate slows down. So you may be eating the same and exercising the same as 10 years ago, but you are putting on weight, and it's really hard for women, and we see that all the time. And so actually you can't just diet to go for that. You have to put the exercise in as well. So I would say hydrate, sunscreen, and think seriously about HRT.
Brilliant. And I always say, let's not feel embarrassed to talk about it. Keep your social networks active, because it's very easy to shy away and feel embarrassed, or oh my god, what's happening to me, or will I be able to find the words, or I don't feel like doing this. But keep your social networks active.
Absolutely.
Do things that you want to do and enjoy doing. Think about life as a clean slate from here on. There are so many things that we've said didn't sound very positive, but there are many positives as well. We are coming to a phase in life when children are growing older, the responsibilities become less. You can think about what new hobbies you might want to try, or be compassionate towards yourself and be kind. Okay, I don't want to do this today, that's absolutely fine. Feel I don't want to wear such clothes, that's absolutely fine too. You can change things in your life and change. Yes, it might feel, oh my god, I'm not the person I was, but you think about a new normal, and I think that's the transformation to think about, to keep your mental well-being really high up there. So Beth, top 5 tips on how to, 1, 2, 3, 4, 5, how to get through this phase with confidence and positively.
Okay. Number 1, get yourself educated. So speak to people, speak to friends that are going through the menopause. Get some good websites. Look on those. Like I said, Women's Health Concern. Get the Balance app. Do some reading. Watch the Davina documentary. I mean, she's done a great thing for women in promoting it. There's a lot of information out there about menopause and what you can do. So get yourself educated. That'd be my number 1. Number 2, look at what you can do for your lifestyle. So everything we've talked about. So making sure that you're eating sensibly, stop smoking, reduce your alcohol, make sure you keep your social network really strong. Think about practicing some mindfulness or looking at some CBT techniques. So those are things that you can do for yourself. If you think you're perimenopausal and would feel you benefit from hormones, then you need to speak to a GP. And what I would suggest you do is, before you book an appointment, is find out who in your doctor's surgery has a special interest in women's health, okay? Because there will be someone that will have more of an interest in women's health, and maybe try and book an appointment with there. I mean, we do still hear some difficulties that patients are getting with their GP, so do persevere with that. What's really helpful before you see your GP can be to fill out a questionnaire called the Green Climacteric Scale. So this is tip number 4, Green Climacteric Scale. And it's a quantitative tick box of what symptoms related to the menopause you're experiencing. And it's quite helpful for women, because a lot of the time they don't even associate that symptoms with the menopause. So do that before you'll see your GP. And then once you're in with your GP, ask for Bodyidentical HRT. That's the way to do it. So Bodyidentical HRT. So those would be my top tips. Educate yourself, look at lifestyle measures that you can do yourself, and then really try and access Bodyidentical HRT via your GP. That's only 3 top tips.
Well, I think you've covered a lot in the 3. There were 5. So That's really fantastic. Thank you so much,
It's
Beth.
been a
Thanks
pleasure.
for giving us so much information and really inspirational that there's a lot we can do
Oh,
about
there
it. It's
absolutely
not
is.
all doom and gloom.
And what I'd just finish on, and what you would say, is that we've looked at life satisfaction charts, and what we know is that often it's at its lowest in the time that a woman is going through the menopause, so in their late 40s, early 50s. But we also know that there's a peak of satisfaction, a peak of happiness in your late 60s into your 50s into your 60s. So life does tend to be on an upward trajectory from here on in, so hang on in there.
And that's the whole point, and that's our mantra is we use this as a transformational experience. Yes, it can be uncomfortable to get through, but we know that there's light at the end, and see it as a life transforming event. So thank you again, and watch my next video here, and if you liked it, please like it, share it, tell it to everybody you know. Thank you for watching.